And for Texans who do want children, they're facing a different problem. According to the World Health Organization, infertility affects 1 in 6 people, and the U.S. birth rate is declining. But one Texas doctor is hoping to make fertility treatment more accessible. Crystal Dominguez has more.
Alix Hancock admires pictures of her 2-year-old daughter, Isla.
Shares toys with everyone, just makes everyone laugh. She is a daddy's girl, and she's so adventurous.
A child she almost didn't have.
And we can't imagine a world without our daughter.
But thanks to in vitro fertilization, better known as IVF, she has her daughter, naturally conceived her son after, and is now planning another IVF transfer for her 3rd child.
If we hadn't had the insurance coverage at the time we began our IVF fertility journey, I don't know if we would have moved forward with it.
IVF can cost between $12,000 and $25,000, but there's no federal mandate in place requiring insurance providers to cover it. Dr. Kaylen Silverberg, a fertility specialist at the Texas Fertility Center in Austin, wants to change that.
Our data show that 88% of patients who walk in our door who are hopeful but yet concerned and very afraid, if they stick with the plan, they walk out with a baby.
He says if insurance can be used for smoking-related diseases, then fertility treatments should be covered.
But when my patients try to use their money for diseases that they actually have, like infertility, there are all of a sudden roadblocks that they've got to climb.
Dr. Silverberg was recommended as an advisor to the Domestic Policy Council
to talk about in vitro fertilization and improved access to fertility treatment. I got a call from the White House inviting me to come meet with the Chief of Staff, which I did last April.
Shortly after taking office, President Donald Trump signed an executive order requesting an analysis on making IVF more accessible. Since then, however, there have been no updates. Dr. Silverberg remains hopeful.
Yes, I think that the president is serious. Again, I've been involved in this for about 20 years. This is the first administration, like them or not, this is the first administration that's ever taken this seriously. And I think that they really are serious about doing something.
Dr. Silverberg is also the head of the Medical Advisory Board for Americans for IVF.
We are working on something called the Hope with Fertility Services Act that we introduced in the last Congress. We had bipartisan support. We're going to be introducing that again probably in the next few weeks for this Congress.
In Austin, Crystal Dominguez, Spectrum News.